42,000 people every year get a new disease by using a CPAP. My doctor didn't tell me this. Your doctor probably didn't either. If you have sleep apnea, I sure as heck didn't learn this in medical school or residency. Of course, this is for educational purposes only. Always talk to your doctor before making any changes. So sleep apnea, why does this second disease pop up if you're using a CPAP? Because when you're using a CPAP, it throws off the basic premise by which your body breathes. That is sensing the amount of carbon dioxide, and when you use a CPAP, it'll just constantly blow off that excess CO2, carbon dioxide, and that will remove the stimulus of your body that tells your brain to expand your lungs and then breathe at night. It's known as treatment emergent central sleep apnea, or if you want to sound really cool, you can say TEXA. Don't say TEXA. Nobody says that. And this was a big study where they reviewed a lot of other different studies, and what they found is that about 8% of people that have a CPAP will develop a new sleep apnea on top of the other obstructive sleep apnea they already have. So if you had a sleepover with 12 of your best CPAP buddies, one of them would have this. And you may think, well, who cares because you're already on a CPAP or something like that. Well, here's the thing. If you stop CPAP use, or maybe you try something else, right? Maybe a mouth guard or just like sleeping on your side or something like that. Well, guess what? Because the CPAP developed central sleep apnea, you will have worse breathing without it. Like you'll be twice as bad. So what are some health educational insights that can help reduce your risk and help your breathing overall? So there's two things that have been shown in literature. One is aerobic exercise pretty frequently because that will raise CO2 levels in your body to help reset your breathing in a way. And then secondly, breathing exercises that cause you to breathe much slower, like box breathing, like 4 in, hold, 4 out, hold for 4, and repeating that. That can also help with that underlying breathing pattern. Now, if you want even more help with your breathing and all that, you can go to apneareset.com/thrive.